Hello, I'm Dr. Laukinen, and thanks for joining me for a discussion about breast cancer radiation and systemic lupus and a focus on risk. So, this is for people that have known lupus and that are thinking about having radiation treatment in relation to their breast cancer diagnosis. So, with any decision to go ahead with treatment or not, it's a matter of weighing the potential good of the treatment and the potential harms. And clearly, we always want the good things to outweigh the risk of harm. And why think about harm, particularly when breast radiation is considered for a person who's been affected by lupus? The idea here is that lupus attacks small blood vessels and it can damage them, the so called lupus vasculitis. But radiation treatment can affect small blood vessels as well. So you have at least the theoretical risk of these two things combining to cause a greater problem. And what we know from mainly older case reports is that lupus and other connective tissue autoimmune uh, diseases have been linked to normal tissue breakdown or necrosis after radiation treatment. And so we have to ask ourselves, how often does that happen? And how often does it happen compared with people who don't have a connective tissue disease like lupus? And when we think about the side effects of radiation, we look at them basically in two classes. One are the early side effects that happen during the treatment or within the first couple of months, or late side effects that are 2 to 3 months on and even years on. And to understand these, we gather information from various studies. And to help compare results, we grade those side effects, where grade 1 is the very mild symptoms, you don't need to do anything about them. Grade 2 is moderate, do some form of treatment and might have a minor impact on daily living. And grade 3 would be much more severe, that would affect basic daily living activities, and a person might even need a period of hospital care for them. So what we know about early side effects is that many people with lupus will have perfectly ordinary early side effects. And virtually everyone having radiation treatment for breast cancer will have some mild and occasionally moderate side effects. And as a general rule of thumb, if about 1 in 6 people in the general population will have these, about 1 in 5 with a connective tissue disease like lupus will. So a little bit more likely to have more obvious early side effects, but not a lot. What about late side effects? I mean, here when we're thinking about lupus's effects on these blood vessels, and these blood vessels can, if they don't work properly, can lead to tissues that aren't as healthy. That would be a long-term type of issue. Well, it turns out that, again, many people with lupus have perfectly ordinary late side effect profile. But a number of studies have said, the probability of having some moderate late side effects is increased. And to the degree that, say, if under 5% of the general population has some moderate late side effects, that maybe it could be up to about 15% of people that have connective tissue diseases like lupus. Does everybody see it that way? Well, there are other perspectives that say, gosh, when we look at an evaluation of people that have had breast radiation and have uh, connective tissue or autoimmune things like lupus, well, we can't actually pick out a clear worsening of the likelihood of these late side effects. So it really depends on the population you're looking at, how hard you're looking at them. What about the worst extreme case where there's a lot of side effects? It could even be life-threatening. Again, some studies say, no, we don't see that. And others say, well, you can find that in the general population at some level, less than 1%. And maybe having connective tissue disease like lupus might add maybe another percent or two to that. Again, small. So just to review what can go wrong, the kind of things that could happen: skin breakdown that causes pain and infection, scar tissue formation, again causing pain and contributing to further tissue breakdown. And because with breast cancer treatments, you include the chest wall and a little sliver of underlying lung tissue, inflammation and scarring of that underlying lung. And because on the left side, the heart comes very close to the chest wall, inflammation and scarring of the covering of the heart if it's in the treated area. So that's the long list. Now, who would be least likely to run into those troubles? Well, if the lupus has not been active. So, for example, a person had a diagnosis of lupus a number of years ago, but it's been stable on a steady set of medications and they haven't had any flares or new organ systems involved. And another situation of less risk is where the treatment is designed to absolutely minimize the coverage of any structures under the chest wall. There's a number of techniques to absolutely minimize lung coverage and hopefully completely avoid any kind of heart coverage. So coming back to the issue of making decisions, if a person has lupus and there is a consideration of radiation treatment, one has to weigh this overall evidence that it is slightly more probable to have, uh, especially the moderate chronic side effects, not dramatically, but slightly, and to weigh that potential harm against how likely the treatment is to be beneficial. And there are some situations where having the radiation treatment is, maybe nice to have, but not absolutely essential, and where there are alternatives, for example, ongoing medications. And then there are situations where the setting is one of really a high risk of local or regional recurrence or progression of the cancer. And in those situations, it makes sense to go ahead with this kind of treatment, given the statistics, and especially if a person's lupus is not active at the time. So thanks very much for your attention.